is teratoma. As you know, the teratoma sometimes it is mostly a benign, most common ovarian tumor for the young girls, and sometimes it looks like a malignant, complex looking, heterogeneous looking, and we need to click the color to understand is there any sign of hypervascularity that can be a malignant tumor or not. Okay, that's why in teratoma we need to click the color. Pelvic congestion syndrome, I gave the lecture on it and you learned it. Pelvic congestion syndrome, yeah, there are a lot of causes are there and definite signs and symptoms, and it is a very annoying situation, and we need to click the color to see if the blood vessels in the pelvic cavity are really too much congested, dilated, and too much flow within the pelvic cavity, within the wall or with the wall of the pelvis, or within the organ, or within the wall with the wall of the organs. We can figure it out by clicking the color. Then endometrial carcinoma. Endometrial carcinoma, it is cancer in the endometrium. Endometrial thickness will be bigger. There will be irregular masses. Sometimes it is confused with the endometrial hyperplasia, endometrial polyp. Okay, so we need to figure it out that it is a cancer or it is something else. If it is endometrial cancer, we need to click the color. We need to do the Doppler to understand is there any hypervascularity or no. When this is a hypervascular, then we need to understand, and it is mass, irregular surfaces, heterogeneous looking, and with hypervascularity we have to figure it out. It looks like an endometrial carcinoma. Then they take the tissue out, they send it for biopsy, and the result comes. Okay, endometrial carcinoma. So now ovarian carcinoma. Ovarian carcinoma, we need to click the color to understand the vascularity. If there is a benign tumor, vascularity is less than the malignant tumor. Okay, and the other evaluative potential, what are those? One is a uterine perfusion, to see the uterine perfusion. Another is tubal pregnancy. Let me discuss this. Uterine perfusion. Perfusion means what? The supply of the blood to the tissue level. Perfusion. Lot of women may lose the pregnancy, and we call it miscarriage. And miscarriage happens one after another. Yes. Why? There might be problem in the uterus. What type of problem? Okay, that means maybe uterus is not getting enough blood flow. Really? It could be. Then how can we evaluate the uterine perfusion? Okay, check the uterine artery, check the arcuate artery and the radial artery. How? Do the transvaginally. You can see the arteries supplying the uterus. And do the Doppler and get the resistivity index. So normally what happens? Normally when during the non-pregnant time or in the menstrual cycle, there are three phases: menstrual phase, proliferative phase, and secretory phase. Okay, during menstrual time and the proliferative phase, the uterus is resistive to the uterus has higher resistivity index Because that time uterus says, I don't want enough blood supply right now. I am not yet pregnant. In the secretory phase, the vascularity increases because a lot of new blood vessels form within the endometrium. So without pregnancy, the resistivity index of the uterus is higher than when the uterus is pregnant. Because of the pregnancy needs more blood supply. And if the uterine artery bilaterally has a poor blood supply, how can I know that? Okay, do the Doppler. See the uterine artery and do the peak systolic velocity and end diastolic velocity. And look at the end diastolic velocity and peak systolic velocity. And do the resistivity index. Resistivity index is peak systolic velocity minus end diastolic velocity divided by peak systolic velocity. Okay, resistivity index, if it is high, then you have to understand the flow towards the uterus is facing lot of resistance. And it's not during the pregnancy, first trimester pregnancy, second trimester pregnancy. Usually we do first trimester and we figure it out. The pregnancy is in trouble or not. If there's a problem, we need to, the doctor will do the proper management. We need to see the uterine perfusion and tubal patency. Tubal patency, you know, they use the dye normally, dye through a tube, and they do some cystogram and tube, fallopian tube. They inject the dye through the uterus, and the dye will go through the fallopian tube if it is a patent. And sonographically you can see the dye is passing. But if you click the color, you can see the color too, because dye is in motion. Because the Doppler is not working unless the flow has a motion. So when the dye is injected, dye has a flow through the fallopian tube, and sonographically with the Doppler you can see the dye, is it passing through the fallopian tube or not. If it passes, you can see the color all through, so you can identify that fallopian tubes are patent. Okay, so now one thing I want to mention here, couple of things with the diagram. Okay, so now I will take certain parts out. Okay. Okay. Okay, I can take these things out too. Okay, certain informations you need to memorize. What are those informations? Normally the internal iliac artery and external iliac artery, with the Doppler, what usually we see. Okay, in Doppler we see external iliac artery, we see only reversal diastolic flow. Early reversal diastolic flow, it looks like this. Okay, so this is early reversal diastolic flow. Okay, you can see that. And internal iliac artery, you will see continuous forward flow in diastole. Continuous forward flow in diastole. What does that mean? The resistance is low. Why? Because it's going to supply all the internal organ in the pelvis. Keep that in mind. Any artery that's supplying the organ, usually their resistivity index is low because the organ needs constant blood supply. But the artery that supply the muscles, skins, they have high resistance, so their resistivity index is high. So when there's a continuous forward flow, okay, you will see this is in diastole, okay? That indicates not very resistive. This is systolic part and this is diastolic part. From here to there, there's a continuous flow. So normally the arterial flow is like this. Okay? So it is high resistive and the low diastolic flow. This is diastolic flow, low. Here the diastolic flow is higher than this. Okay, so internal iliac artery you're going to see, and the iliac veins has a continuous flow and may have respiratory variation. Continuous flow. Okay, iliac veins have continuous flow, may have respiratory variations. Means it may show the phasic. Okay, I'm doing both. Okay, so when it is continuous, this is continuous, and with the respiratory variation like that. Okay, this is continuous and this is phasic. Okay, this is iliac veins. You may have this. Okay, now ovarian artery. Get the physiologic changes of the ovary. The ovary has follicles and ovary has a big follicle. These are the small follicle and it has cell, that is a ovum inside, and you know the ovum has layers of cells, that is granulosa cells, theca cells, so this is, say, Graafian follicle. So this is Graafian follicle. Graafian follicle means it's a definite healthy ovum and ready for fertilization, right? Ready for fertilization. And at this phase, it completes the first meiotic divisions. Completed. Okay? So now it is ready for ovulation. Okay? And at this point, the Graafian follicle, it completes the first meiotic cell division and it starts the second meiotic cell division. And as we know that second meiotic cell division completes when the sperm enters into the ovum. Okay? And that time it produces the second polar body. Okay, so now when this ovary will have a ovulation, so these are follicle, they did not take part in the Graafian follicle, they did not grow. Okay, so now this is Graafian follicle, and the Graafian follicle has cells around it. Those are highly active. They need constant blood supply. Constant blood supply. When it is a Graafian follicle, and the blood supply will be needed more blood supply. So more blood supply to the ovary to give the nutrition for this Graafian follicle. And when this is pre-ovulatory phase, and this is the ovulatory phase. So if this is up to here, pre-ovulatory phase, and from here to there, ovulatory phase, and from here to there, post ovulatory phase. Okay, so now pre-ovulatory phase, they need blood supply. Ovulation phase, they need more blood supply. Post ovulatory phase, if this corpus luteum, after ovulation it will be turned into corpus luteum. If the ovulation took place, this is the egg, and now there will be no egg inside, and you know all the cells around it will be very vascular because they have to produce the progesterone. They have to produce the progesterone, and the cells in the corpus luteum is a globular shape, and it has a lot of fat inside because they need to produce steroid, that is progesterone, and they need more blood supply. Then what happened the blood supply during the post-ovulatory phase? In the ovulatory phase, the resistivity index will be low. Post-ovulatory phase, there would be resistivity index will be low. And when there is no ovulation, say at this phase, pre-ovulatory phase, the resistivity index will be high. That's why we need to take the history from the patient when was your LMP, and do you have regular period or not. So now in pre-ovulatory phase, when you do the Doppler, what are you going to see? You will see the high resistive. Okay? And ovulatory and post-ovulatory low resistive. Okay? Low resistive. The peak systolic velocity will be low, peak systolic velocity, and this is end diastolic velocity is higher. Okay, you can make it little higher. Okay, it indicates that resistance is low. Forward flow of the arterial blood to the ovary is more. Why? Because the corpus luteum is active now. Corpus luteum is active now. Okay, so you have to take the history, and this is called luteal phase. This is corpus so during the corpus luteal stage, the resistivity index will be low, and before the ovulation, during the pre-ovulatory phase, the resistivity index is higher than the ovulatory phase and post-ovulatory phase. We need to remember those things. And during the functions of corpus luteum, it would be low, and during the first trimester, corpus luteum stay inside the ovary up to 10 to 12 weeks. During the first trimester, you will see the ovary gets more blood supply. That's why resistivity index will be low. Okay? How we gonna know it? Do the Doppler. Do the Doppler. Then you will see it. Okay? And and in immature follicle, you do the Doppler, you will see no diastolic flow at all, or very low around the immature follicle. Immature follicle will show the high resistivity index. Okay, so this is ovarian arterial supply Doppler. Ovarian arterial Doppler evaluation. So now I will discuss about the uterine arteries. Uterine arteries are the branch of the internal iliac artery. Okay, let me draw the diagram, then it will be much better for you. Okay, I'm not drawing the ovarian, okay, the obstetric uterus, no. So this is internal iliac artery. I'm just giving the idea. So this is internal iliac artery or hypogastric artery, and from the internal iliac artery, this is the artery is going to enter into the uterus at this isthmus level. So this is isthmus level. Okay, and when it enters the isthmus level, it goes under the perimetrium. I'm drawing in one side only. Okay, so this is arcuate artery. It makes an arc around the uterus, and there are two uterine arteries. So this is uterine artery. This is also uterine artery. So you need to evaluate the uterine artery outside of the uterus, part 1, and under the perimetrium, there is a part 2. Okay, so these are the arcuate artery. Okay, from the arcuate artery there is a radial artery. So this is arcuate artery. So this is arcuate artery. And these are the radial artery. Radial artery is named because it move forward along the radius of the uterus towards the endometrium. That's why its name is radial artery. And at the end of the radial artery, there is a spiral arteries. Spiral arteriole. And this spiral arteriole is in the endometrium. It is in the endometrium. So this part is endometrium. And this part is in the myometrium. Okay? Now, arcuate artery runs making an arc on the surface of the uterus. Arcuate artery is also under the perimetrium. Okay, under the perimetrium.